I find that when women come to see me, they feel lost. They feel like they haven't been listened to. They feel like they're a little bit of a nuisance to whoever they've been seeing.
Women lead healthcare consumption across the country. They make all the healthcare decisions for their families and for themselves. However, women's health has been neglected in many fronts.
Gynecology and reproductive health care is hard to discuss, and what may be very normal, very common, a woman might have but might be too afraid to ask.
It is our obligation to run toward the problem. It's really time that there's a place that puts women's health at the top where it should be.
Hey, Sylvia.
Hi, Dr. Swain.
How are you?
Good.
So you're here so we can talk about what we're going to do on Wednesday, right?
Right.
Okay. I think, like we talked about, your decision's a good one based on your symptoms and
Right.
your response to all the medical treatments that we tried. Okay. Sylvia became my patient many years ago. I took care of her during 3 pregnancies, and I delivered 2 out of 3, which is actually a pretty good statistic. There aren't that many patients I've delivered all 3 or all 4 or all 5 of their children, except those who have many at a time. It's sort of cheating.
This started a couple of years ago. I started having a lot of more difficulty with increased bleeding. It was very scary because I wasn't sure what was going on. When I came to see Dr. Swain for my annual exam, she did notice that I was very tired, and she noticed that my iron level was really low.
When people come in and see you every year and you've seen them for 5, 10, 15, 20 years, you get to know patients pretty well. It's not just about their physical health, but we hear about family and you hear about social issues and what's going on in their lives. Sylvia had already made her family planning decisions, so she was done having children after the 3rd one.
After reviewing all of the options, I decided, even though I am very young, to have a hysterectomy. I felt that this is the best decision for me in the long term.
The relationship building is important because there has to be an element of trust. And that trust isn't just that the patient trusts the physician. The physician also has to trust the patient. And that means that we know you, we care about you, and we will do what we have to make sure that you're okay.
The Pavilion for Women was created out of Texas Children's mission to improve neonatal outcomes and the long-term quality of life for our children. And quickly you learn that you don't separate obstetrics from gynecology.
We take care of women throughout their teens, their 20s, their reproductive years, their postmenopausal years. And all problems associated with gynecology could be addressed in this building. There are 3 large OB-GYN practices. We have minimally invasive surgeons. We have urogynecology and female pelvic medicine. There's also the menopause clinic where not only do the physicians have the ability to address the physical symptoms of menopause, a psychiatrist is also part of the menopause center.
It's a one-stop shop for me, basically, and I think they have put a lot of attention into the comfort of a patient.
We have had, from the very beginning, a women's advisory council where you have women involved in design, in the functionality of the pavilion, and talking about programs. And we really work closely with the physicians to make the overall patient experience the best that it can possibly be. And the physicians know patients' and families' needs better than anyone, and it's been critical to our success.
The pavilion is shiny, it's beautiful, but it was also laid out thoughtfully. It lends itself to collegial interaction, where we are trying to improve patient care, patient safety, and our own knowledge.
It's a beautiful facility, but at the end of the day, without the people and the programs inside, it's just a beautiful facility. Our physicians take it personally. They help build the Pavilion for Women. It's a reflection of them and their practice. It truly has been, created and built from the ground up by listening to women.
So, Carla, I'm going to just go ahead and open up your chart here, and we're going to go over all of your medical history. Okay. I specialize in taking care of women who have vulvovaginal disorders. A lot of women will come to see us for their pelvic pain. They've had chronic pelvic pain issues that stem maybe many years. They will come to see me from all over the South and even as far as California when their primary physicians are basically done with their resources. They don't know what else to offer them. Toxins or chemicals or pesticides. No. And Carla came to see me for a specific skin condition that does cause a lot of distress, both emotionally and physically.
Right.
Is there any other kind of autoimmune disorder that I need to know about?
Lichen sclerosis.
Lichen sclerosis, okay.
Usually my partner. When I saw other gynecologists, they would say, "You're in menopause. I mean, we can't do anything about it." You kind of accept that, and then you go home and you think, it's painful to get old. My first visit with Dr. Bias, she wasn't that way at all. She's a very caring doctor, and she wants to solve problems. She made me feel very comfortable from the beginning.
The beauty of what happens here is I can give these women the time that they need so that they feel like they're being heard. They will have at least an hour worth of time so that I can take a very detailed history from them and really get to the root of their problems. Has this been going on for a lot of years?
About 10 years.
10 years, oh, okay. Very recently, I operated on Carla. She's doing amazing. She's pain-free for the first time in a number of years.
That was a big surprise. I am extremely thankful. I mean, I can't even tell you. It's like the difference between day and night.
We, as a country, have a deficiency in the number of physicians who can take care of these women, and the need is becoming more because women are seeking out care. They're talking about it more. It is getting destigmatized.
If my mom or grandmother were around, they would come to this place and they would feel like that they had died and gone to heaven.
Hello. Hi, I'm Dr. Bias. It's so nice to meet you.
All right, I'm going to start your antibiotic.
Okay.
And then I'm going to give you your margarita.
Oh, great.
All right. It's a top shelf margarita.
Oh, perfect. The whole team here is excellent. They're very warm. They're very friendly. To me, that's very heartwarming.
The bedside nursing and the nursing leadership is not only world class, but is incredibly collaborative relationship between the physicians, nurses, and the patients. Anesthesiologist probably explained to you it's sort of like a little bit of a time warp. The overall goal for any patient, right, is ultimate health, but we also want there to be understanding in health. To have the healthy patient who understands the choices that she has for her care, so she is empowered to make an informed decision. I want any woman who has a problem related to gynecology to think and to know that she will get world-class care at the Pavilion for Women.
Nice deep breath.
Our staff and our physicians love to be here, and you see it, you feel it. When you walk down the hall, when you greet people, you may hug 2 or 3 people, you stop in the cafeteria, you're in the clinic. It's awesome to have a job where you know you can make a difference throughout the day.
I get to help people. And that's really, really the crux of why all of us went into this. So if I can make someone's day better, it might be something little, like a patient comes in and says, I had a bladder infection last week and you treated it and I feel so much better. That sounds so silly, but really, I'm like, yay, sweet, we helped.
Sylvia? Hi.
Well, I've known Dr. Swain many years. She knows me very well. She calls me personally to discuss any concerns that I have. I enjoy coming to see her. I enjoy the talks that we have. It feels very like family.
It's hard to find the right doctor. And I'm so fortunate that I was able to get to Dr. Bias because it's been a great experience. I don't think I would ever go anywhere else.
Carla?
Yeah.
Okay. It's very, very gratifying when a woman comes back to my office and they are crying happy tears because I've given them back something that they didn't have for so long. Whether that's peace of mind because I just gave them a diagnosis or the ability to not have any more pain. I feel like I'm here for a purpose. So I love what I do.